Good afternoon. Now it's my turn and honor to present the following two presenters. The first two elegant presentation was Joe presented the Egyptian data, and we are happy and honored by this. Dr. Morello presented the Colombian data, and now it is the turn of Professor Luiz Antonio Santini, a surgeon and the current director of the NCI in Brazil, to present the Brazilian data on breast cancer screening strategy and implementation in Brazil.
Good morning. Thank you very much. I would like to thank especially Dr. Ben Anderson and my friend Eduardo Casap for the invitation to participate in this summit. And I am very happy with the attention being given to Latin America in this summit. As you know, in a few weeks, Dr. Casap will assume the presidents of UICC. It is the first time in many years that a cancer control visionary for South America will be leading the UICC. Congratulations for that. The summit addresses how cancer prevention and control programs in low and medium-income countries can be adjusted to reflect the realities of how the healthcare systems are organized or financed. I will try to follow that what Joe Harford presented, and I will be grateful if Joe permit me use your presentation as a scenario that I will talk about. I will summarize at the first moment the Brazil healthcare system and its public financing, how our healthcare system approaches early detection of breast cancer, our effort to expand access to cancer screening, our effort to optimize the limited resources by targeting early detection services, described the tensions between what the public health science informs and what the public and the advocates clamor for, and described our efforts to promote dialogue and consensus in order to maximize improvements in breast cancer outcomes. As you know, Latin American population is more than 500 million people, and here we see Latin America's contributions to global cancer incidence and mortality. The incidence is about 1 million new cases each year, and the mortality is 600,000 cases. Brazil's population is nearly 200 million people and represents 1/3 of the region population. Brazil is the world's 5th largest country, both in land size and in population. It has 26 states and a federal district, and 5,000 municipalities, many with small populations, and are the 15 cities with the populations exceeding 1 million. So let me first tell you about Brazil's healthcare system. Brazil, since 1988 Constitution, established health as a universal right and responsibility of the states. Access to the service is universal, and there are no fees or co-payments. the SUS, a unique system of health. The public is jointly administered by 3 levels of government. States and municipalities have a considerable administrative autonomy, and the public expenditure per capita is about $350, about 4% of GDP. 20% of population, 41 million Brazilians, have a private health insurance. Brazil has an ambitious goal to expand cancer care infrastructure, hire and train more human resources, and provide more services. Assets has been expanded, as you could see. The quantity of public cancer care services has grown significantly over the past decade, especially the resources devoted to treatment, which doubled in 8 years. Breast cancer is the leading cause of cancer mortality in women in Brazil. Lung cancer has been rising, but with the smoking rate declining, we expect lung cancer will crest and decline over time. Breast cancer incidence and mortality rates in Brazil are lower than many other countries and regions, even when age-adjusted. 50,000 new cases per year and occurs, and 17,000 deaths per year occur. We have noted an important region difference in breast cancer mortality within Brazil. Note, there is a north-south gradient with highest breast cancer mortality rates in the south and low rates in the north. When we look at the cervical cancer, the mortality will also see north-south gradient, but in the opposite direction. It's explained by the difference of income, difference of especially economic difference in the distinct regions, different regions. Now I will talk to you about early detection. Our Women Health Initiative started in early 80s with many programs supported by civil society, NGOs, especially the Kellogg Foundation. In 2003, National Cancer Institute, INCA, conducted a consensus process to develop a national recommendations for breast cancer prevention and control. The consensus document issued in 2004 defined target groups among women according to age and recommended frequency of mammograms and clinical breast exams. There were also recommendations for high-risk women. Although the federal ministry issues consensus recommendations, the states and municipalities health secretariats run the programs. It's